Good afternoon and welcome to the session on supply chains and innovation. I'm McLaughlin, Programme Lead for the Health Supply Chains at Scottish Enterprise and Chair for today's session. Before we started, let's introduce the panel. Joining me today are Jacqui, McLaughlin and Jardine and Stephen Binnie. Jacqui, would you like to introduce yourself and give us a brief overview?
My name is Jacqui McLaughlin. I'm the CEO with Reactec Limited, a small to medium enterprise, Edinburgh-based. We specialise in monitoring equipment for health and safety risks. Our key offering is to monitor people's exposure to harmful vibrations in the workplace. So we have wearable technologies, we have an Internet of Things ecosystem and hosted data analytics. That's all developed in-house. We use Scottish contract manufacturers and we sell directly to our clients.
Over to Sarah.
Oh, good afternoon. My name is Sarah Jardine. I'm Chief Operating Officer for the National Manufacturing Institute Scotland. The National Manufacturing Institute is a group of industry-led manufacturing research and development facilities. We're located out in Shannon, in the heart of what's going to be the new Advanced Manufacturing Innovation District out there. We're known as NMIS and we exist to transform skills, productivity and innovation in Scotland, helping to make the country a global leader in advanced manufacturing. We work with businesses of all shapes and sizes across the manufacturing sector to give those organisations access to industry-leading resources, expertise and skills to help them increase their productivity and to help them de-risk innovation and turn their great business ideas into reality.
Thank you, Sarah. Stephen?
Good afternoon. My name is Stephen Binnie. I'm Managing Director of Alpha Solway. Alpha Solway are part of Globus Group, a UK manufacturer of PPE with over 25 years heritage supplying multiple sectors from construction and manufacturing through to healthcare. Our product portfolio includes hazard clothing, protective gloves, hard hats, safety wear and respirators. The company is family owned and started out in Shetland many years ago, where we're still proudly registered. The head office and supply chain function are now located in Manchester, and we have 3 UK manufacturing facilities: Warrington in North West England and Dumfries and Annan in South West Scotland. The group currently employs over 400 people and we expect to pass the 500 mark pretty soon.
Okay, thank you all for taking the time to join this panel. We have 30 minutes this afternoon to reflect on the COVID-19 pandemic and the impact it's having in organisations as we try to reevaluate their operations, markets and supply chains. As we leave 2020 behind, the vaccination programme is now well underway, which provides hope that the end is in sight, although we're always constantly reminded to review government guidance to the manufacturing sector to ensure the safest operations possible. Like most parts of the economy, manufacturing was seriously impacted by COVID-19 as markets adapted to shifting demand and constraints around supply, not least the ongoing tier restrictions and national lockdowns that were required to limit the spread of the virus. It's been said that to overcome adversity, we need to start by doing what's necessary, then do what's possible, and then suddenly we find that we're doing the impossible. And hopefully that discussion will help us take a view along that road. So perhaps start off discussion by asking the panel to look back over the last 12 months and to describe how the pandemic initially affected your industry and how your organisational plans were affected or impacted by the kind of key issues and challenges that you faced during that time. So could you kick us off, please, and tell us about your experience as the pandemic started out?
Well, I think the one thing that is now the case and wasn't 12 months ago is 12 months ago no one knew what PPE was. I think that's very different scenario now. As a business, we had one manufacturing site in the UK employing 75 people, with plans to develop that into respirator production in the UK as well, mainly in the back of Brexit and a increased sense that there was more interest in UK made products, and that was driving those plans. I think that's still the case. We still have obviously developed a manufacturing footprint in the UK, but are much faster pace. We've always developed our products in the UK, but we've typically relied on third-party relationships with long trusted partners, mainly in Southeast Asia, to produce a lot of those products. The pandemic had a massive impact late February, early March. Suddenly, our equipment, our materials, our finished products, our production capacity was basically being commandeered by governments in those countries, making for local demand. Raw materials were scarce on the ground, and demand for the products that we supplied into the UK marketplace were huge globally, well beyond anything that was available in terms of capacity. Our industrial market virtually closed down overnight. Most manufacturing businesses, certainly construction, stopped building whatever they were doing. But the healthcare demand became massive, and suddenly there was products all over the place which was poor quality, unsafe. Everyone was an expert suddenly in PPE. We didn't get involved in that initial rush to market with poor quality product. That's not what we are. What we're about. It's not what we do. We took a long-term approach and took control of everything from the supply of raw materials through to final manufacturing, and started to fast-track those plans to develop UK production facilities, with the long-term goal to have 75% of our products made in the UK as quickly as we could. We worked closely with NHS Scotland to develop the solution for their needs in terms of respiratory protection and masks that was both cost-effective and crucially worked for their workforce. We knew our brand was trusted in that market, and we wanted to ensure that the product we delivered maintained that relationship we had with the user. That goes off the ground, and we started supplying product quickly to NHS Scotland, and it led us into longer and deeper conversations with the UK-wide governments. As a consequence, we set about identifying 2 new factory sites. One is in Dumfries, and a second in Warrington, North West England, which is actually quite a challenge in the middle of a pandemic to go and set up 2 new facilities. So I guess for the past 6 months, we've been really busy doing all of that stuff, and we set up 2 sites to make respirators, which by the middle of 2021 will have capacity for 1 billion healthcare masks a year and over 300 million FFP respirators over that time frame. Something we are exceptionally proud of, but still exceptionally busy doing.
Okay, no, thanks, Stephen. So it sounds like there was kind of extreme challenges in your supply chains globally, limits raw materials and access to equipment, and that's hopefully we'll touch on that as we go on. Hopefully, manage to kind of turn that around. Okay, Jacqui, what's been your experience working with Reactic?
Okay, so I guess picking up on some of the things that Stephen said there. Our customer base was severely impacted at the beginning of the lockdown in March. We serve manufacturing, we serve construction, and a lot of those type of industries either went into a furloughed, lower capacity mode of operation or are completely mothballed. Now, the way our technology is offered to the marketplace, we're actually able to remotely monitor the extent to which our equipment is being used. And we actually dropped to only 10% of normal operation levels in that initial period. So the challenge for us was actually an economic one of being able to survive and operate the business, because without being able to engage with our clients, that impacted us directly. So we did take advantage of the furlough arrangement. So we furloughed at one point, I think, up to about 40% of our staff. The biggest impacts were definitely in the first three months. We did see some impact on our supply chain, where the supply chain was actually prioritizing capacity to medical applications, which was actually something we were actually able to, positively support because our business demand had actually dropped off. But the one thing that we did while we faced those sort of challenges and basically tried to operate as effectively as we could is we took the decision not to furlough our technical staff. So we carried on with our strategic roadmap, if you like, in terms of our ambitions for the technology and in going beyond what was our core expertise in the area of monitoring vibration. So we had put out a 3-year roadmap of expanding beyond vibration as a health place risk. And we were wanting to look at other risk areas such as noise and dust. So we took the decision to keep those efforts going because we had the view that as horrible as the situation was, it had a finite time. Now our estimations of what that finite time might have been were rubbish, but I think it's still the reality that it is a finite interruption. So we were very much trying to manage the business for the long-term situation where we could potentially come out of the pandemic in a stronger position than we actually went into it by carrying on our efforts in terms of technology development.
Okay, thanks for that, Jackie. I think I'm interested there. So you talked about remote monitoring there. So that's also been sort of digital tools, I guess, have been kind of quite helpful to your business. So that's like an interesting thing maybe we'll pick up on as well. Thank you for that. Okay, Sarah, so your experience, I guess, was slightly different coming from NMIS. So what's been your reflections on the challenges faced with businesses this year?
Yeah, I think those stories are really interesting from both Stephen and Jackie, and also, a lot of positives to be taken from those stories about, adaptability, flexibility, about being able to reconsider the position of your business and adapt to those market needs. And I think, something like the pandemic, when you're coupling it with Brexit and we've got climate emergency looming in the background everywhere as well, these things can sometimes feel like, they're all challenges, but there are lots of opportunities. Unfortunately, for a lot of businesses during this time as well, we've gone from being just in time to just about working, and supply chains with, single points of failure in some of those supply chains. There are links that are falling down all over the place. And I think, listening to what the other members of the panel have said, I would recognise that there's going to be, going forward, maybe an increased focus on made in Scotland or made in the UK to try and improve the resilience in that supply chain. I think, like Stephen was talking about, we'll see a lot of factories decentralising to reduce those single points of failure and really try and provide goods and services where they're needed. And I think the watchwords for the manufacturing sector as a whole will be flexibility, an ability to easily diversify and an agility to respond to this type of thing going forward. And we've seen that, in our experience in NMIS over the time, or over the last sort of 10 months, we've seen, everything from, organisations, manufacturing organisations who made clothes starting to make masks. We've seen distilleries, making hand sanitizer because they've got, those skills. And I think, that word skills is really important too. We've seen, Jackie saying that they didn't furlough their technical staff and they kept on with that strategic roadmap with a view to the future. And we really need to think about the skills of the workforce going forward, because that flexibility, agility and diversification needs to be there in the workforce as well. So I think there's a lot of challenges ahead, but a lot of opportunities. And we've seen that over the last 10 months. I think we'll continue to see that in the next couple of years.
Okay, thanks for that. Thanks for that input. Appreciate that. Okay, so I guess just coming out there, things like important skills, sort of flexibility and agility, and I think we've all kind of touched on that point. So maybe talk a little bit about how you overcame the issues and rose to the challenges that the pandemic presented. What worked for you, and importantly, what didn't work for you? Was there anything that you did in terms of investing in capacities, supply chains, products, services, business model innovation? So just to give a flavour to the delegates of what your experience drove you to do in order to try to achieve what seemed to be the impossible at the start of the pandemic. Maybe start off with Jackie, perhaps.
Sure. So I guess in my initial answers, I mentioned the fact that we continued on our strategic roadmap. So our ambition was very much about using the sort of technologies that we had developed for one particular risk in the workplace, which is exposure to vibration. We wanted to be able to take the way that we approach that, which is all about having sensors to be able to collect real life data on what's happening, and having a system that can gather that data automatically and then bring that data back to the employers in an informative manner to help them manage the risk. We were keen to take that and apply it in other applications, and we'd set our sort of mind on things like noise and dust, which are very much adjacent to the sort of risk that comes with vibration. But once we had sort of got our heads around the worst of the lockdown impact on our business, one of our engineers had an idea of using the technology that existed in the product to enable the Internet of Things type connectivity, to actually use that same technology to determine distance between two devices. So it was just an idea, but what we were able to do was to basically act on that idea extremely quickly. So we assigned all of our engineering team to the project. We were able to market test with our client base reasonably quickly. And basically within about 5 weeks of the concept, we had a proof of concept product with a tier 1 construction company. Who were able to give us, again, real use feedback and the benefits of it. So basically what it's doing is it's helping maintain social distancing in the workplace. So a little bit like Stephen's story, we weren't there for, if you like, what we thought we could be used for, but it was just applying that lateral thinking and applying it to what was the problem of the day. Now, it did challenge us very much. It challenged, obviously, supply chain again, because we anticipated it's the sort of thing that would be very useful for a lot of employers. I probably over-egged our ambitions in terms of what we needed there. So we did ramp up our supply chain and very effectively. Again, we do manufacture in Scotland, not for parochial reasons. We've gone through evaluating supply chains in the Far East. We've also used some contract manufacturers in England, but we've always had our most effective interactions more locally, especially when you have to be agile, especially when you have to be agile about your technology, but also your demands. So that worked well for us. We did end up having more inventory than we probably would have ideally wanted to have, but that's opened up another new avenue for us now, because what we've started to do is offer our technology to the marketplace on a service plan. So rather, as you might do with your mobile phone, so you don't have to pay for the capex spend up front. It's something that you can basically pay over time, and that actually is something that it was an ambition for us to do, but you're always worried about the cash implications of doing it. The fact that we were able to execute that during the pandemic was again testimony to the fact that the new application helped secure up the business, and now that's a positive feature that we're able to offer our client base, and that they see us not as a capex and a horrible capex that they have to think about. So a sort of mix there of good and bad, but what it's definitely done for us is our strategic objection was to move beyond a single risk in the workplace, and we've done that without actually imagining what that risk was that we might be able to help, and that's opened up new client base to us. So we're talking to environments where vibration is not a risk, but they're seeing obviously COVID as a risk everywhere, and we are able to help these clients. And we've also gained some traction internationally, whereas previously in our focus within the world of vibration, that was very much a topic that the UK seemed to care more about than other countries. And again, with this new application, that's got us into new territories. And maybe just if I can mention one more thing, an area of skill that we've found ourselves having to develop or at least strengthen is actually marketing. So in our specialist area of vibration, we are quite easy to find. If anybody puts in that word, they're more than likely going to see Reactec associated with it. But with this new application, it's a busy, busy space. So we've had to get into digital marketing in a way that never had before. And again, seriously impressed with the sort of digital marketing skills that are available locally and that we've been able to tap into and contract to help us with that.
Okay, thank you for that. Stephen, what's been your experience? What did you do? What worked? What didn't work?
I think there's lots of things didn't work. Well, hopefully we'll learn from that. I think what COVID-19 gave us was actually a huge opportunity. I think that was the most important thing, is take the approach that, you know, that there's something we can do here that is going to, one, help the business grow, make a difference, and get us in a really strong position in a very different market, because the market changed fundamentally. And I think to do that, we had to recognise where the strengths in the business really were. We were, you know, very innovative, very agile, very can-do approach to doing business. That's what we were. But we weren't that as a manufacturer. You know, that was in the UK anyway, so it was a smaller part of what we were. And I think we had to apply that same kind of thinking to the manufacturing side of the business to look at, well, what do we need to do and how do we get there as quickly as we can? And I think once you get that mindset, the rest of it starts to fall into place. We had the expertise in the product. We knew how to create the solution that was required by our new customers, NHS, healthcare market, and develop that for them. And I think that then required us to go and learn new skills. You know, how do you set up factories quickly? How do we find the right partners to make the machines we need? How do we scale it up? And, you know, we've become, you know, a huge manufacturing business within, you know, 10 months. Our manufacturing scale has increased by probably 20 to 30 times. We used to employ 65, 70 people in manufacturing roles. We're now north of 400. So that, I think, doesn't happen when you overthink it. I think that happens when you just have to get on and do it. So in terms of, you know, COVID has actually driven our business in that way, and I think in one respect, probably the only respect, I'm grateful for it, for that. You know, and I think we've been fortunate to have the support of an established customer base to do that, and have the strength in our business to be able to invest a huge amount in making this happen. And our market's changed for the long term. I think that's the other thing we did, is we took a long-term view to this, and that the products that we seen a huge spike in demand for, well, isn't actually a spike. It's clearly more than it will be, hopefully, in a year or two's time, but it doesn't drop back to pre-COVID levels. I think that's the reality. We're going to have to live with face masks in some form for the foreseeable future. And I think the need for that, and the need for that to be made locally, is something that is well established now within the thinking of healthcare organisations and the government. You know, so they recognise the value in UK-made, Scottish-made product. I think that's a fundamental change. It's not just about the ticket price of the product now. It's about, you know, the reliability and the resilience in the manufacturing of those products. That's given us huge confidence to invest in the future in UK production, Scottish production. In terms of mistakes, yeah, I think I've made more mistakes and got more things wrong in the last 10 months than ever. I think that's part of it as well. You've got to have the belief in your product and go and make those mistakes too. Okay,
thank you for that. Thanks, Stephen. Okay, Sarah, so we're kind of pushing for time here, so can I maybe hand it over to you just to kind of maybe reflect on the input from our company representatives today, and maybe give us that kind of outlook as you see it and where you think NMIS certainly could offer support to the companies moving forward.
Oh, absolutely. I mean, I think, like I said earlier, I think these are great stories. I do like to hear that people made more mistakes than they had successes as well, because that's actually how innovation works. So we get things wrong, but we keep trying. And, you know, to hear those success stories in the face of the pandemic has been really good. I think, you know, a few key points there about, you know, sort of manufacturing locally, reshoring supply chains, and I think, you know, Stephen's right that maybe pre-COVID, the balance of supply chain was tipped in favour of cost. Post-COVID, I think we're going to see the balance of supply chain being tipped in favour of resilience. You know, that actually it's about understanding, you know, where the points of weakness are in that supply chain and making sure that we've got options and alternatives in there. You know, I think as well there are, you know, we talked prior to the COVID pandemic, we talked a lot about Industry 4.0 at conferences like this, and you know, those digital technologies and that type of thing haven't gone away. I think that, you know, digital technologies are going to provide manufacturing organisations with improved resilience. They do help reduce risk and cost. You know, particularly when you look at things like a digital twin, where you can try things environment before you are actually going to try them out in the real world. So I think, you know, and those are a number of things that NMIS can help with. We're also, we've got a project called Additive Manufacturing Business and Technology Support, or AMBATS as its snappy name. And, you know, that's where our team are able to help offer SMEs access to digital technologies and direct access to additive expertise across our group, which can be really useful as we come through into the post-COVID world as well. And also in our Skills Academy, we're going to be, we've got a project which is the National Transition Training Fund, NTTF, which is looking at helping to reskill and upskill people over the age of 25 and who are at risk of redundancy, and looking to give them skills in the areas where there's the greatest potential for future growth. So there's a number of ways that NMIS can help manufacturing organisations, and encourage you to reach out to us and talk to us about those things, and we'll be able to talk to you about some of the funding that's available for manufacturing organisations at this time as well.
Okay, thank you for that, Sarah. Okay, so I think we're kind of coming to the close of the session right now. So perhaps if I could just take the opportunity just to draw delegates' attention to the Scottish Government's recovery plan for manufacturing. So that's been published in draft form right now, and it's out for consultation. It's been pulled together with input from industry, public sector, trade union and academia input. And it proposes a set of actions that could be practically taken within the manufacturing community over the next 12 months. And the consultation period has been extended to the 12th of February. So plenty of time to read the draft and offer out some feedback. So I think we can close off the session here by passing on our thanks to Jackie, to Sarah and to Stephen. And thank you for your contributions today. It's been very insightful, and I appreciate your time and sort of spending it with us. The panel is going to be available after this session for a short Q&A, so I'd like to invite all delegates to come and join us, and then we can take some more questions and encourage some more discussion. So enjoy the rest of the Can Do Summit, and please stay safe.